Good day, everyone. Now I'm going to give you some of what went down at the second press conference that kept the other day, and this time we're going to hear from Zulika Jess. First, Zulika emphasized that many communities in her constituency, St. Elizabeth Northeast, remain severely cut off by damaged roads and debris caused by the hurricane. She expressed frustration and government directed relief efforts have been slow and efficient for the scale of the devastation. Second, she said she made the difficult decision to defy the government's directive against using private resources to clear roads because lives were at risk and people were essentially marooned. Engaging private contractors to clear and reconstruct major roadways in communities such as Burnt Ground, Abram Road, Horton Avenue in Southampton, and Grass Peace. She admitted that even with her personal resources, she cannot help everyone, so she has asked the state National Works Agency, that's NWA, to intervene for all of those who are still isolated. Third, Jess brought attention to the severe inadequacy of the central government's financial relief package. While the government allocated a flat amount per constituency, $10 million under the support program.
Good morning. Today I come before you with a very heavy heart. Today I wish I didn't have to speak because I understand that by speaking I run the risk of being accused of complaining. But I speak because I have a duty to the people of Northeastern St. Elizabeth who elected me to be their voice and to be their compass. My issues today are multiple, but I will give you the abridged version. And I'll start with the long-standing practice which has really merged into a convention whereby ministers or officials of the government ought properly to notify a sitting member of parliament before entering that MP's constituency to do any government-related issue. Now, that is not just a matter of parliamentary etiquette or constituency etiquette. It has its rationale in ensuring that as the duly elected representative of the people, you can be informed as to what is taking place in your constituency, so that by extension you can inform the people, so that you can make yourself available when the government officials are present to continue to represent and advocate on behalf of your residents and your constituents on issues that concern them most, issues that you might not have an opportunity in the parliament to raise because of the rules of the parliament. In a time like this, a very sensitive time when the most vulnerable are most at risk, we expect that that practice would ensure that there is collaboration between the government officials and the elected representatives to ensure that persons can benefit. In my constituency, I have had to sit and watch as persons approach me the day before a visit to ask me if I heard that the Minister of Local Government is coming into the constituency. What is it that they're coming to do? Where can they meet them? And I have no answer to the questions because I was not notified in advance. In my constituency, first the Speaker of the House came, and perhaps she came in her capacity as an individual outside of the politics, but by her utterances, she made statements to suggest that she had visited communities, and every community that she visited, residents were not hopeful that they would get any assistance from me as the Member of Parliament. And I thought it was very unfortunate that in a time like this we would seek to sow seeds of division and discord, because the Speaker of the House visited 3 communities, all strongholds of the Jamaica Labour Party. Not one PNP community was visited, not one PNP community was given any of the care packages. In fact, the areas visited are well known: Rocky Hills, Santa Cruz, Burnt Savannah, which is regarded by Edward Seaga as Little Tivoli. No reference was made to any other communities, but the speaker formed the conclusion that every community she visited were not hopeful that they would get help to build back houses or do repairs. And I speak on that because she came into the community on Saturday morning, and by Saturday afternoon, the Minister of Local Government also visited the constituency. He distributed care packages, 60 to the sitting Jamaica Labour Party Council, but I was not informed of his visit prior. The 3 other councillors who happened to be PNP councillors were also not informed of the Minister of Local Government's visit, and of course they got no packages from the Minister. Only the JP Council received packages. And finally, the Minister of Justice came on Friday, and my constituency office happened to be right next door to the venue that he visited. I was not notified in advance. No, it doesn't matter. I see the statement from the minister, and labeling a statement as being contained or filled with lies or accusing me of lying does not make it untrue, and it does not change the facts. The facts remain, as I stated in my earlier video, that the minister came into the constituency without prior notice. The minister came into the constituency
for a post-military building. She said in her constituency alone, over 600 persons sought housing assistance on the first day her office reopened. She explained that with limited funds, benefits are often negligible. In some cases, only enough to buy sheets of zinc. Finally, she stressed that the relief distribution need to be equitable without regard to political affiliation and based on actual needs, not to one-size-fits-all approach. She argued that many residents continue to suffer with lack of food, building materials, and even basic mobility to access medical care and education or supplies. So you see, oh God, they need help. They really need help, and I'm praying and hoping that, the government just pitch in and just do what they're supposed to do. Just do the right thing for the people of Jamaica. So thank you guys for listening. Thank you very much. So please like, share, and subscribe. God bless you.
Why? Because we're striving towards good governance. In England, they have codified that almost, in a sense, by having ministers' code, which set that out, that ministers of government must notify and not just give just passing notice on the day, but proper notice. Perhaps it is time for us to implement that here in Jamaica. Secondly, I speak on the issue of housing because the speaker made mention that persons that she spoke within the communities, the JP communities that she visited, were not hopeful that they would get assistance. Like many of these members of parliament, I also received only $10 million as an allocation for housing repair. On the very first day that my constituency office reopened after the hurricane, we had over 600 persons in attendance at the office asking for housing assistance. Over 600. And when I went into communities like Mosquito Bottom in Windsor, they didn't even know that there was a deadline given by the government to report on matters such as those, that their information was never captured. I raise it to say to you that the government, you've heard, has given a directive that they are recommending that you give 100,000 to each beneficiary. I have not been able to do so. I have taken the decision that I cannot choose who should benefit and who should not. I cannot choose who should get help to put on back their roofs and who should not, when everybody needs help to put on back their roofs. And so every one of those 600 and odd persons who applied for housing assistance, I've submitted their names. And so it means that they're not going to get 100,000 each. It means that some of them are going to get $12,000, which is only probably 3 sheets of zinc. But what do we do when the funding is not sufficient? And yet we make it clear. I have PNP people who voted for me, I have JP people who voted for me, and I have people who never support the politics before and them go vote. So I don't care who people vote for. When I go into a community to distribute supplies or to assist people, I have never asked them who they voted for. Once I have it, I'm going to share it, even though it means sometimes getting quarrels from your own supporters who feel as though you're helping the other side more than how you're helping them. And I say this to say that we do not support the practice of division. We do not support the practice of undermining duly elected representatives whose only intent is to provide help for people who are suffering. We see people who are in need. We don't see JP and we don't see PNP. We see people who are vulnerable and who are depending on the government to make the right decisions so that their lives can be better. And that's the only objective that we have over here on the People's National Party side.
In addition, you will hear Dr. Dawes giving his take or his speech on the fundings and what's going on in this area. So just listen up and, follow along.
Thank you, Senator, Leader of the Opposition, my colleagues, members of Parliament, journalists here, those who are tuning in, good morning. I also wish to greet those who are tuning in merely with the disgraceful intention of trying to distort what we say and to edit clips to present a false narrative to suit their own agenda. I greet those who have spent their lives playing politics to stop playing politics with people's lives. Today, I give you an update, having met with the technical team at the Ministry of Health, the Minister himself, and being on the ground, conducting missions, meeting with persons who are actively involved in trying to improve and assess the health situation in the most badly affected Western parishes. We must give what is due to Caesar. The Ministry of Health has, in fact, done quite a bit, as Dr. Campbell said earlier, in terms of being responsive to deploying some of the clinics and the restoration of services at some clinics and the improvement of the infrastructure of some hospitals, such as Cornwall Regional Hospital, having now had a roof replaced by Médecins Sans Frontières, or Doctors Without Borders. We, however, are very concerned about whether or not public health care is getting the attention it deserves. We have to understand that the crisis that is unfolding now out west, it is not merely the realm of the Ministry of Health and the technocrats, doctors, nurses, and vector control workers, public health inspectors. It is not under their control. What is happening is that it is a multidisciplinary, multifaceted approach that is needed to stave off the impending crisis. We are already in the midst of a leptospirosis outbreak, and we could have seen this coming. We ought to focus not only on trying to send out information to say avoid streams and water, avoid rodents, but we ought to look at how we can address the environmental factors that are causing this outbreak. Garbage collection is an issue. It is piling up not just out west but across the island. Even in my constituency, that was largely spared from the brunt of the hurricane. Water is an issue. We heard from the MPs that water is rising in some areas. There is a stench of dead animals, and you cannot simply say to people avoid contaminated water when that is the only water that they have available. So we have to look at the cleanup, we have to look at the access, and it is this multimodal approach that we're going to have in tandem with the work of the Ministry of Health that is going to stave off a worsening of the leptospirosis outbreak, as well as try to mitigate, if not completely avoid, the threat of dengue and chikungunya. When we speak about leptospirosis being an issue, it is a disease that is largely mild, but when it gets bad, it gets bad. And it can lead to death because of liver failure, bleeding out, renal failure, and therefore early diagnosis and treatment is essential. Questioning the capacity of the Ministry of Health to adequately confirm cases of leptospirosis. Do we have the capacity locally to test for leptospirosis? What thoughts are being given to deploying rapid kits into affected areas where we can test for the antibodies that are elevated when you have an acute infection? Early testing helped in COVID, and anyone with a passing knowledge of medicine understands that the earlier you intervene in a disease, the better the outcome, as well as the less likelihood you will have long-term complications. So we need to be testing. To say that we have 11 cases of leptospirosis begs questions. Are we testing enough? Are we missing cases? And if we are faced with a national outbreak, can we ramp up testing to have results back to see whether or not the case that we're dealing with in front of us as a physician is really leptospirosis or not? So we need that information from the Ministry of Health, and what are they saying about the use of rapid kits that can be made available at clinics and even with partnerships with private doctors, as well as distribution through volunteers who are going into the communities conducting medical missions. There are still critical shortages of basic medical supplies, manpower, and of course functioning equipment, some of which would have been damaged during the passage of the hurricane. We know that there are patients who have lost medication because they do not have a fridge that is working, because they do not have a generator. And therefore you have to be concerned about non-compliance as a result of these socio-economic factors that are now more than ever playing a role in healthcare. We have gotten some complaints about the process to facilitate missions. There seems to be a lack of coordination on the ground. Even if persons are fully registered and they have been listed as partners, they still face some obstacles, whether or not the team on the ground were expecting them, and who are they partnering with to mobilize the people in the community. In many instances, if the members of parliament are not a part of the mission initially, they do not have the wherewithal to rapidly get out persons and mobilize them to take advantage of the free medical services. So again, this is an echo for partnership and not just trying to have hegemony over the relief efforts. And this includes the medical missions. Now, when we speak about the way forward, because this is not going, the situation that exists on the ground is not going away anytime soon. There are too many people who are homeless, there are too many people who are marginally living on the fringes of survival. And as a result of that, the conditions that exist for leptospirosis to continue